Morning, guys. It's like 4:30 in the morning, and I'm gonna try not to wake up my daughter. She's 5 feet from me. Just want to get this out there. I've been trying to when I fell asleep trying to get Ari to bed last night. So for the first unit, remember that anticipatory guidance is when we're teaching the parents what to understand with their child's development and how to actually help them grow, help them reach those milestones. It helps them understand what to expect, what to look for. So some of the toddler milestones that we need to know are they become basically independent. They're definitely learning the word no. They're very proud of any of their new accomplishments. They'll show them to you. Obviously, their growth rate and the amount of food they eat slows down as compared to the first year. In toddlers, their birth weight quadruples by 2 years, but if you remembered in the first year, it's like triples by 5 months or some weird, crazy fast numbers like that. Toddlers are able to walk up and down stairs. They undress themselves. They are learning how to scribble on paper. They take the crayon and scribble. They're able to kick a ball. Their vocabulary by the end of toddlerhood generally has about 1,000 words. And they're able to use like short sentences. Toddlers that play, just remember that toddlers parallel play. They are they're playing different. They may be playing different things, but they're playing right next to another kiddo. They're not playing really with them, but they're playing next to them. They learn that if they manipulate objects, they can actually learn about them. Like the example of those balls with all the whole different shaped holes in it and put the blocks in it. So their communication, like I said, is generally at least 1,000 words. Oh, sorry, I'm not a morning person at all. They can imitate words and speech intonations. These are the groups you don't want to swear around because no matter how many times you get them to try to get them to say a certain word, the minute you say a swear word, they're going to pick it right back up. They're right up right away. Like I said, short sentences. They understand more than they can say. They have a lot of the expressive jargon. My niece, you can pick out words very well at times, but other times she's and it is the cutest thing. I love their little expressive jargon. A lot of their communication might be nonverbal. Like they might, if they want a cookie, they might grab an adult, pull them over to the cookie jar, and point at the cookie jar. So that leads us into preschoolers' development. Know the definitions, egocentrism. Basically, that preschoolers got there. They don't understand that everybody else has their own point of view. Transductive reasoning. These are when those kiddos, they connect two events just because they occur together. Maybe they were naughty and that night they got sick and put in the hospital. So they'll think that, hey, I'm in the hospital because I was naughty. Centration, they're only able to focus on one aspect of the situation. For example, they may be having surgery and they know that they have to get an IV, so they are focused on the IV. They don't care about the rest of it. They're just more focused on that IV. Animism, they actually give inanimate objects lifelike qualities. If you remember from the other lecture, I we had John Smith the vacuum cleaner in our house, and I don't know how many times we had supper with John Smith and watched TV with John Smith. It was terrible. Preschooler milestones. They are using scissors and colors. They're riding bikes with training wheels. They're able to throw a ball. Their speech is well developed, and they're starting to play well with peers. So their play is associative, which means they interact with each other during their play, and dramatic, like they're living out the real drama of human life, like they are playing doctors, they're playing house. Preschoolers and healthcare. These preschoolers really benefit from the concrete visual aids because they really don't know what to expect at doctor visit. Sorry. School age. School age kids experience growth spurts at different times. Girls 9 or 10 years old, and boys are generally about a year later. And sometimes it's obviously not expected that, but that is the rule of thumb. School age play. They've got more physical abilities, so they can play different things, and they understand the rules of a game. So like they can play kickball, and they know the rules, and they know what roles they're supposed to be in. So their type of play is cooperative. So they're cooperating with each other. They are eager to learn and follow the rules of the game. And then they understand their rules. So my example of kickball, they all know the rules of the game, that you have to run to each base, and if you get hit by the ball, you're out. And then they also realize that, yeah, but I'm at first base, she's at second base, she's pitcher, so that they understand more. Kids like to learn and assist and learn at the same time. This age group really does well with learning from example. So they might be in the kitchen making cookies with mom, and that's how they learn to make cookies. Communication strategies, concrete examples with pictures to go along with any verbal explanations we're giving them. Make sure we assess their knowledge before teaching. Like I said in my first lecture about this, if you underestimate what a kid knows, if they know more than you think they do, they're going to totally shut you out. I saw this firsthand with my daughter. They kept saying they were going to give her arm a hug, when in all actuality they were doing orthos, and she would rattle off, well, don't you mean you're doing orthostatic blood pressures? So I'll lay down for 5 minutes, then you can come take it, and then I'm going to stand, sit, and then I'm going to stand for, this amount of time. But to get an actual number, you have to have me standing for 10 minutes. So it was really kind of funny, actually. Let the school-age kids select prizes or rewards when they follow rules or go through procedures. If you remember this at the dentist's office, a lot of dentist offices have prize boxes. Or if they're doing something that is a rule and they follow it, give them something in return for behaving. Always include the kiddo in discussions with discussions and asking about a history of the child with the parent. Don't just rely on the parent's point of view, because you're going to get a lot more information from the kid if you include them. Adolescence. Just remember, this is the end of childhood, beginning of adulthood, where they're actually trying to form and figure out who they are. There's puberty and rapid growth changes. These kids become less dependent on moms and dads for transportation because now they have their own license or their friends have their license. And peers are more important than anything else. So, review Erickson's stages of development. I'm not going to go through all these with you, but infant trust versus mistrust, toddler autonomy versus shame and doubt, preschooler initiative versus guilt, um, school age industry versus inferiority. Um, industry just means being able for them to make something, to be helpful, purposeful. Adolescent is identity versus role confusion. So that gets us into the coping mechanisms of children. Regression, where they actually revert back to a previous behavior. And we'll get these terms also in mental health portion of this. But regression, where they're reverting back to a previous behavior. Repression, they are involuntarily forgetting a traumatic event. A lot of times this may happen for people who were abused as children. They don't do it on purpose, but they store it in their subconscious and can't pull it out. Rationalization, they're making the unacceptable acceptable, where they are making an excuse for whatever the event was. And then fantasy. They deal with what they feel is an unacceptable fear. Maybe they're scared of needles, and maybe they pretend they're a superhero, and that way they can do the IV. So that gets us into injury risk based on age. So infants, their injury risk depend on the caregiver, because that infant is completely dependent on them for everything. 6 months, the risk increases because that kiddo is becoming more independent, more inquisitive. They're learning to crawl and explore. Siblings can be a risk factor. I know when my daughter was 6 months old, my oldest daughter, well, she did it from the time she was brought home from the hospital, but if I was in the shower or whatever, I had to take Bailey with me and have her strapped in because my oldest daughter would balance her upside down on the car seat handle. Daycare, there's lots of other kids there. There's a lot of ways to get injured at daycare. Drowning is a huge risk for these kiddos. And they can even drown like in the dog dish, whether they're crawling around and then tip over and fall into the dog dish. They don't need a whole lot of water. Choking risk, they put everything in their mouth. Electrical cords, they're crawling around and can get in behind stuff. And then stairs are open doors, they're going to explore. So then 12 months, it's the same risk, but the risk is even more increased because they're even more independent. A lot of times these kids might be walking, running. So toddler risks, they are at a huge risk for increased falls because they just move their chair over to the counter and climb up and get their cookie. Poisoning because they put everything in their mouth still. They might find cleaner underneath the sink and decide to drink it. Burns because those kids are just at the right height to reach up and touch the top of the stove. They're at risk for drownings and getting injured in a motor vehicle accident because they may undo their seatbelt or they may resist their car seat. I actually had this happen yesterday. My cousin's daughter would not sit in her car seat for anything for my aunt, and when they went to go over to my mom's house, and my aunt had to go to work, so she had to drop her off at my mom's. They slid past the my mom's driveway on the ice and almost hit a mailbox. And it was because Hannah was not in her car seat. Well, not the only reason, it was slippery, but Hannah was not in her car seat. Preschoolers, their main injury risk is a motor vehicle accident. School age, motor vehicle accident, and it doesn't mean just them being in the car, it also means them being a pedestrian, because they might run out and get a ball, or them being on their bike and getting hit by a car. So teach to wear a helmet. Give them a prize for doing it. They're at risk for guns in the home if they're not locked up. Burns because they might experiment with fire chemicals. And assault because they're walking home on their own now. And they might be home alone. Say they get home at 3:30 and mom and dad don't get home till 4:30. There's that extra time in there. Adolescents, injury is the biggest health hazard because they have this, oh, it's not going to happen to me attitude. So their number one injury risk is a motor vehicle accident. That's because it's a new skill to them. They might be distracted and vulnerable. They might be texting or playing on ChapSnat or whatever else it may be. And they might be going to parties. So driving's a scary thing for them. Sporting injuries, their sports are more competitive. So they're more physically challenging. Drowning, guns. These are the kids that are out able to hunt on their own now. Risk factors, farm machinery, power tools, and mechanics, because now they're starting to work on their own vehicles, with the farm vehicles. And then last but not least is the abuse, because they are really seriously starting to date. Sorry, I had to go make some coffee. My orange soda with no caffeine was not cutting it. So on to the next unit, infant immunity. A baby's immune system is not mature when they're born, so they passively get these antibodies from mom. But once they're born, that protection fades. So they're still, babies still get sick. Their protection or their antibodies aren't 100%. And then, so we give them vaccines based on what their risk factors are, their what they're going to what they may come in contact with, and depending on age, so that they can get their immunity boosted by the time they would run into some of these things. So, what are some barriers to vaccination? Economic factors. Sometimes parents feel they're too expensive to go to the doctor. Sometimes there's limited access to health care, or the clinic is only open during the working hours. That's why I love the clinic we go to. They stay open one night a week till 8 o'clock, and so that they can get these people that would normally not be able to go to the doctor. Like my husband works, leaves the house at 7 every morning, gets home at 5:30 every night. There's no way he'd be able to go to the clinic during the week. So they stay open till 8. So people like him can actually get in when they need to. Maybe the parent doesn't understand how important vaccines are. It might be a religious prohibition. It could also be a cultural thing. The Amish around here, very rarely do they get their vaccinations. Some do, because, like I said, the clinic I go to, they treat a lot of Amish, and I think it kind of depends on how strict their sect is, or how strict the parents are. But their view is it's God's will. Some people feel, well, the disease is not a threat anymore, kind of because it's been eradicated out because of vaccines. But if we stop vaccinating, then it may come back. Some feel that the side effects from the vaccine do not justify the benefit. There are so many different views on this one. I do have a friend who, when her son got one of the vaccines, he did become deaf, and it did come back that it was because of that vaccine that he became deaf. The Gardasil vaccine that I got my daughter twice before she got sick, it has also come back that that is a side effect, that her POTS may be a side effect from that vaccine. So this one I kind of beg to kind of plead the story with. But all vaccines have some sort of side effect. Like the MMR has a swelling. So it's kind of the parents decide if the causes from the vaccine are worse. There's also saying that, I can't remember all the details. I had the article up and I read it just last week. But you know how the deal was that vaccines cause autism. The guy that started that was actually debunked and actually is sitting prison time for falsifying information and whatnot. So there's a lot of things that are not truthful out there about the side effects. Parents might believe that they can control the child's susceptibility to the disease. Not always true, because you don't always know when people are sick. Might feel that the vaccine is dangerous. Here's the autism, the SIDS thing. Parents feel that vaccine might not fully prevent the disease. Yeah, well, it might not fully prevent the disease, but if they do get the disease, it'll be a lot less severe. Some people feel that they don't want the government to monitor the vaccine status. Yes, they kind of do on like the immunization records, but there may be a big, huge other part of it too. So what can we do as nurses? Educate the parents. Talk to them about what are the risks and benefits of the vaccine, what are the risks and benefits of the illness. Answer any questions they have, and advocate for that kiddo, because the disease can actually be worse than any of the vaccine side effects. So when we are assessing our kids for what vaccines they need, we need to make sure we're looking at their immunization record. Look at the catch-up schedule if they're behind on their vaccination. Minor illness or fever is not a contraindication to vaccination. The only time that we do not give a vaccine is if they have had an anaphylactic reaction in the past. So when we are going to give it, we need to ask about any past reactions to the vaccine, if they're pregnant or plan to become pregnant, and if they are allergic to any of the vaccine components like eggs or neomycin or gelatin. So getting into some of these kiddo diseases. Chickenpox. Chickenpox is contagious until all the lesions are dry and crusted over. It starts out with some vague flu-like symptoms, and then a rash will start. Sorry, I couldn't figure out what that noise was. It's my coffee pot. Starts as a papule, then goes to a fluid-filled clear blister, and then that blister will break and crust over. And these kids might have different lesions at different stages. Fifth disease, stage 1 again is those vague flu-like symptoms. And then stage 2, they have a bright red rash on their cheek that looks as like somebody slapped them. That rash will start on the trunk, go to the extremities, except for it will not be on the palms of their hands or the soles of their feet. Stage 3, that rash is going to fade over. Mono, I lost my mouse. Transmitted through direct contact with body fluids. It's also termed the kissing disease. And symptoms are going to be basically flu-like symptoms, but they're going to have an enlarged spleen and lymph nodes. Mumps, it's a respiratory transmission. You're going to see a lot of the flu-like symptoms, but then they're going to have the swelling of their parotid, their sublingual, and their submaxillary glands all along the sides of their neck, face area. So because of all that swelling, they're going to have earaches, headaches, and obviously pain with chewing, which also turns into decreased appetite. Lyme's disease is transmitted from a deer tick that has been infected with Borrelia burgdorferi. The symptoms are this bullseye rash, and then a lot of the flu-like symptoms. If it progresses without treatment, these folks are going to see fatigue and meningitis and facial nerve palsy and cardiac problems, and it actually may develop into arthritis. So we need to make sure we're teaching our parents that they're dressing their kids in long pants, long shirts, long socks, and hats. Diphtheria. Characteristic lesion for diphtheria is just this grayish membrane in the back of their mouth that actually can extend into the trachea or cause obstruction. Sore throat, enlarged lymph nodes. Pertussis, there's 3 stages. The first stage, the catarrhal stage, is cold symptoms for 1 to 2 weeks. And the paroxysmal stage is the cough stage. It's the forceful coughing that's followed by a stridor. And with the like when they inhale, so it kind of sounds like a whoop. That whoop might actually be absent in the vaccinated kids. Then it goes to the convalescent stage, 6 to 10 weeks, where it will generally resolve. Measles kind of starts out with some of the general flu-like symptoms. The fevers are going to be high. They're going to have inflammation. This coryza is the inflammation of their nasal passages. And the Koplik spots are like the deep purple spots on the back of their mouth. Stage 2, that it's a maculopapular rash. It's dark red to purple. It almost looks like petechiae, but it'll begin on their face and spread to their trunk and their extremities. Otitis media, the inflammation in the middle ear. It's basically just a eustachian tube dysfunction. You can go through this part here. Epistaxis, nosebleed. It's commonly caused by nose picking, dry air, trauma, or foreign bodies. If it is one-sided, it's an anterior bleed. Two-sided is posterior bleed. So, anterior bleeds, we want these kids to sit up, tip their head forward, and pinch just under the nasal bone, and make sure that they're holding it for 10-15 minutes. Their head needs to be forward, not backward, because otherwise the blood's going to enter, go down their throat and enter their stomach. Oh, my daughter bought these on that coffee. Ugh, I want regular coffee. Posterior bleeds generally have to be packed by a doctor. And then lead poisoning. Kids are at greater risk because they're smaller and retain more basically because their weight is smaller. Kids at 7 and under are higher risk, and this lead actually interferes with cell function in like the nervous system, the blood cells in the kidneys. I'm going to pause and get this video up, and then I will do a mental health one all on its own.